So let's get more on the national vaccine rollout and bring in the president of AstraZeneca Australia, Liz Chatwin. Liz, good morning and welcome to News Breakfast.
Good morning, great to be here.
We know that the first Pfizer vaccine is going to be given on Monday. When is the first AstraZeneca vaccine going to be jabbed into someone's arm?
Well, we're so excited with the announcement yesterday that the TGA has concluded that the AstraZeneca vaccine meets the high standards for safety, efficacy and quality for use in Australia. This is wonderful news for Australia's fight against COVID-19, and it's also a remarkable example of what science can do. So your question is about when. So we're working at pace now to bring the first doses of the AstraZeneca vaccine into the country. We're not sure exactly which date it will land, but it will certainly be here in time to start vaccinating from early March.
The concern for over 65s, what do you say to people who still think there's a question over that?
I think I would say if you listen to the Professor John Skerritt talk yesterday, so he's the head of the TGA and he's looked at all of the data of all of the vaccines, and his team has concluded that it's safe and effective to give the AstraZeneca vaccine to all adults over the ages of 18 years. So there's no age limit. While we have still more data to come, as you know, this is a global pandemic and we're collecting data all the time. We have seen strong immune responses in all people aged over 65, and also 100% of people in this age group exhibit antibodies to the AstraZeneca vaccine. So John Skerritt said yesterday there's no evidence to suggest that the AstraZeneca vaccine won't be effective in people aged over 65, probably to really reassure people in this age group. Tens of millions of doses of the AstraZeneca vaccine have been given to people around the world, and many of those have been in age 65. In fact, John Skerritt hinted yesterday that they've seen some of the real-world evidence from the rollout in the UK, and that it's looking very promising for all age groups.
How damaging has the misinformation been that's gone on social media and still today is out there?
No, I agree with you. It's been a bit of a roller coaster ride for this data, but we're actually very proud that we've committed to full transparency together with Oxford University to release the data as it emerges. We believe that it's really important to educate people on the scientific rigor and safety processes around the development of the vaccine. We know that the science can be quite complex and extremely fast moving, but to conclude, what we know today is that the AstraZeneca vaccine is 82% effective at preventing symptomatic COVID-19, and that's when it's given at a dosage interval of 12 weeks apart, and also reassuringly 100% effective at preventing severe disease, hospitalizations and death, and is also safe to use in all age groups above 18.
Now, the gap between the first vaccine and the second has been extended to 12 weeks. What kind of protection will people get after that first injection?
That's an excellent question. So the recommendation by the TGA is to give the AstraZeneca vaccine at a dosage interval of 12 weeks. We know that that provides the best vaccine efficacy, but important to reassure people that after 3 weeks after the first dose, so that's when the immune response kicks in, after 3 weeks, there is 100% protection at that time against severe disease, hospitalizations and death. And that protection lasts until the second dose is given 12 weeks later.
Liz Chatwin, good to have you on the program.
Thanks so much for having me.